Basically, it's because for men. I think it happens for men. If they overuse certain part for cyclists, right? I think Lance Armstrong was one of them who had a major prostate cancer. So that's how I know more about.
It's a kind of cancer that affects men.
When you become aging, you are prone to have this.
Prostate cancer is the third most common cancer among Singaporean men, with more than 500 cases diagnosed every year. But many are unaware of its risk and what causes the disease.
It is something to do with sex. He just didn't use the proper ways to do it and stuff.
It could be your lifestyle, anything, just unhealthy eating.
Maybe, I think sometimes doing cycling, perhaps it's a bit too much of cycling.
His father had this cancer before and it is inherited to him.
Probably causes like smoking as well contributes to it.
In Singapore, the risk of developing prostate cancer has increased 5.7 times over the past 40 years, but the exact cause of the disease is still unknown.
If you do dietary modification, healthy lifestyle, exercise and so forth, you can actually prevent it.
Dr. Wong Sing Wing, a specialist in medical oncology, however, thinks otherwise.
Those beliefs are without scientific basis. I would call them myths. Healthy living does not prevent prostate cancer.
While the causes
Pain
are
in the
unknown,
abdomen,
the symptoms of the cancer are more clear-cut.
Problem in urinating and pain, sometimes pain in the groin, these are one of the very early indicators that something can be wrong. But it's easier said than done. It's just so easy to overlook these symptoms, and that's what happens with these patients as well.
In a recent survey, Singaporean men cited castration as their biggest fear of having prostate cancer. Treatment for prostate cancer usually involves surgery, chemotherapy, or medical castration.
Totally affect manhood.
It's still difficult because it's an issue of confidence. I think it will still show in terms of self-esteem and all that.
It will affect the psychic, but I guess it's a better alternative over dying. I guess it's the same as a female going for breast cancer and having to remove breast because it's too advanced a stage.
Dr. Wong explained that medical castration does not necessarily have to affect a patient psychologically.
When we talk about castration, a lot of the times it is not physical. It can be done physically. The testis can be removed, and therefore removing the source of male hormone, which is driving the cancer growth. But it also can be done chemically, by medication, by injection. So anatomically, the person is unchanged. You get an injection every 3 months, and that sort of puts the testes to sleep, stop them from producing male hormone. You can achieve the same effect without physically removing the testes. And sometimes emotionally, that is important for the patient psychologically.
In the next clip, prostate cancer survivor Richard Tan shares his experience coping with the disease.